So thank you, Joanne, for taking the time. I'm here to interview you because we're going to offer TFT now within IFPEC, and I'm thrilled. I'm going to be the, as you know, the trainer.
Right.
And so I want people to understand what it is that they're going to be learning if they come. And you'll be coming next year to do the advanced level.
Yes, I'm very happy to be here. Seeing Corrine work, because this has been wonderful. She's very sharp, and so I'm really excited to have IFPEC bring Corrine and offer TFT in France and in French. I'm excited to be sharing that with them, and it'll be a lot of fun to come back next year. I was there last year at the conference, and I'll be coming maybe next year when we'll offer the advanced class, which she's just about to take here in Portugal.
So I want to convey how revolutionary TFT is, and for most of our students are trained in EFT. So my main goal is for them to understand the differences. But first, can you tell us who you are and what is TFT?
I'm Joanne Callahan. That means that my late husband, Roger Callahan, was the discoverer of all tapping. We trained everybody from Gary Craig on, that's in ASAP and the energy psychology world, in the beginning with TFT. And I helped him develop it. I established our training programs in 1994, our first training, and it's now become my mission, as he passed away about 5 years ago now, to carry it on throughout the world. And I'm very blessed to actually be able to do that.
And I want you to understand, you who are watching the video, what can be done with TFT. So can you tell us an example from your life of how it revolutionized your life?
Maybe one of the most profound examples is in 2001, I was diagnosed with stage 4 non-Hodgkin's lymphoma. Everybody has the fear of cancer. And I had it throughout my body. I had it in my bone marrow. I had tumors here and here and here. I did no chemo, no radiation, and I've been cancer-free for 16 years this month, actually, and I had no recurrence. It was with TFT that I was able to maintain my quality of life throughout my healing process. I never had a down day, actually. I have pictures of me in Mexico City doing a training. I looked like a chipmunk because the lymph glands were like this, but I didn't have a down day, and it was our ability to determine specifically what we needed to do for my healing process that allowed me to heal. We could first...
Sorry, that is exactly the point of this interview, you know, what is so specific and different about TFT?
Well,
especially in comparison to EFT.
Well, in comparison to EFT or the other tapping modalities, they're at what we call the algorithm or beginning level. The word algorithm merely means a common tapping sequence or a common tapping pattern. And the purpose for that is simplicity. And so there is a good reason for doing that. However, it limits your ability to be specific about what is needed. And where that comes into play is with toxins and with what we call psychological reversals or blocks to healing. When you're working in other energy systems like the Dantians, which is the Chinese energy centers, or the chakras, you need the ability to determine where exactly you need to do something and what it is you need to do.
Let me maybe explain a little bit what you just said, because most of the viewers won't have taken TFT or seen TFT sessions. When you talk about Dantians and chakras, which are other energy systems, you actually work with more than just meridians and tapping points. You have 3 ways of tapping into the different energy systems, right? So that's one big difference.
Correct.
And then you talk about psychological reversals. And I think it's important that people know you test in the past, present, future, and at all levels,
of our
all
multidimensional being.
Of the being. And toxins, can you tell us a little bit more about toxins? Because this is something that doesn't exist in other energy psychology modalities.
I want to give two examples there. One, my own personal one with when I had cancer. I took interferon, which is a bacteria that boosts the immune system, and anybody that knows anything about it knows it's very nasty side effects. You feel like you've been run over by a Mack truck. You ache to the very core of your being. I was able to take interferon for 1 year without any side effects. Now, the doctor couldn't believe that. They handed me a prescription for Prozac when they gave me that prescription. And the reason was I was able to identify it as a toxin and identify the sequence I needed to do to neutralize it. So I could go 1 whole year. I didn't have a down day during my cancer. I traveled and I treated and I worked and did everything that I had done before and after the cancer. So that ability to identify and neutralize that toxin made a drastic difference in my quality of life.
There you're actually talking about neutralizing side effects of medication, and so many people are on medication nowadays. But even without medication, can you give us another example of a toxin that was almost life-saving? And I know there's one in your life that was life-saving. Do you know which one I'm thinking about?
Oh, yes. Okay, but before I was going to say something. Just before I do that, I just want to add that when you have to be able to diagnose or determine, to identify a toxin, and then to be able to neutralize it. When you're dealing with medications, the first question that always comes up is, are you interfering with the efficacy of it? And no, it never interfered with the efficacy of that. We've done it with AIDS medications, with chemotherapy, with many medications that are common and toxic for people, without interfering with the efficacy of it. Okay, so now, when I had cancer, one of Roger's early works in research demonstrated that cancer tumors have a negative polarity. And when they're negative, they're growing. When you can change the polarity, which can be measured with a voltmeter, a simple voltmeter, to a positive polarity, they shrink and die. So we monitored my tumors throughout the body daily, actually twice daily, to identify the polarity.
Right, and you had tumors everywhere.
Yes, right? Yeah, I was stage 4. So we made the effort to maintain a positive polarity. And what we found was the single thing that would change those cancer tumors into negative polarity was laundry soap, toxic laundry soap. And that's talking about the traditional laundry soaps. And what we did was I tested and found 3 good organic ones, and we rotated them. And I even would change clothes midday, because what happens is as your body heats up, you absorb the laundry soap. And in that way, we were able to maintain a positive polarity in those cancer tumors. And of course, I'm here today because of it.
And we're glad about it.
But that's a perfect example where had I not been able to identify what was causing and maintaining the reversals in the tumors, it would have been a different outcome, or a much more difficult road.
Right. So we have the psychological reversals, we have the toxins, we have removing the side effects of medications. What's different about TFT? More things that are...
well, the psychological reversals, those are blocks to healing. And I just want to expand on that, because we find them in, as you said, past, present, and future, and our multidimensional being. And when you have a chronic and recurring problem, it could be that it's not because it's in this dimension, the physical body. It could be in the subtle dimension. And if you have no way of testing and identifying that, you have no way of treating it, really. You can guess and you can try. So those ability to identify very specific blocks and where they are allows us to get much deeper, faster results.
Right.
Yeah.
So one big difference, EFT, for example, it's a blanket sequence for everything, everybody.
And that's for ease of simplicity, which is a good thing.
And yours is specific to the person, the moment, the circumstances, the problem. And can you explain why is that so important?
Everybody's unique, and we all know how unique we are. And everybody's physical, mental, emotional, and subtle bodies are unique. And so while one combination of things could be a general releasing, relaxing of stress and a healing, it won't do everything for everybody. And in today's world, most people have a complex life. And so when you use TFT, when you use the process of identifying the exact sequence, it works kind of like a combination lock. You can have all the numbers, you know all 14 meridians, but you could stand there all day and go through it 10 times before you got to the point if you actually tested and found that it was the lung meridian they needed for their problem versus the eyebrow. And it allows you to identify exactly which meridian. The other thing that we can do.
So what you're saying is you could have the numbers of the combination, but if you don't know the order, you cannot open.
Right. If you have, say you know that the numbers are 14, 20, and 10, but you don't do it in the right order, 10, 20, it's not going to open. Right. It isn't going to reach the same result. It's like, driving from Paris to
Lisbon. We are
to Lisbon. Okay, getting from Paris to Lisbon. There's many ways to get there. You can take the train, you can fly, you can roller skate, you can hitchhike. Some ways are going to be a little more difficult than others. Some are going to be a little more uncomfortable than others. Some are going to be slow. Some are going to be fast. It's how much discomfort and how much time it takes you to get there. If you have a common tapping pattern, like an algorithm, okay, that you do over and over and over, you may get there, but you may have been walking. And if you're working with people that are suffering, that difference is important. It's significant. Can I give an example?
Yes.
We had yesterday in our class, we were working with, we work with past lifetimes and multiple dimensions, but when we do that, we always make sure we have universal consciousness permission. And one of the students was giving an example of checking for permission for something, and she started telling the story, and she immediately went into meltdown. It was a very personal story about a family member, and she immediately went into meltdown. I was able to test and give her treatment points, check for her reversal or blocks, and do it in a matter of
3 minutes,
3 minutes, 5 minutes, 3 minutes, so that she was again feeling good without her having the need to repeat the story or relive anything. In other words, I was able to end her suffering immediately.
In fact, that makes me think about how much work you do with PTSD in Rwanda, in other parts of the world, and how with TFT you bypass the cognitive, you don't need to talk about anything, and you can treat somebody even if you don't really even speak the same language. Can you talk about the work of TFT specific to trauma and PTSD?
With our foundation, we do a lot of trauma work all over the world. We've done 3 very good, actually, studies demonstrating that it's effective. Evidence-based is what they call it now. But and the beauty of TFT is you can go anywhere in the jungle of Rwanda and teach it to the children, and you don't have to have a literal translation for anything. You can just see how they're feeling and lead them through tapping. You can determine a sequence in a matter of minutes specific to whatever they're feeling at the time. And so it's not, they don't have to understand an affirmation. And a lot of times when you're working in other cultures and other languages, the affirmations can actually be an obstruction.
Or even just the cognition or the words or the
because of
set
the
of phrase or
the phrase. Because, for instance, in Kosovo, when we worked in Kosovo a long, long time ago, they had many therapists come in early, but it was against their culture for the males to admit to a psychological problem. So they couldn't say those affirmations. They couldn't make those statements.
Those statements like, even
I
though
deeply and profoundly accept
this.
myself. Yes. And see, that was the first statement Roger had. That's where that came from. Roger's first statement, and it came out of hypnosis, was even though I deeply and profoundly accept myself, even though I have this problem. That was first, but what he found over time was it could be corrected simply with focusing on the problem and tapping. And the cognitive aspect of it often will get in the way.
That's why it's called thought field therapy, because you're really tuning in. Can you mention what happened with that man in Rwanda who was treated over 2 sessions and he had a horrific experience?
Yeah, and this is where this type of example, and we have many of them, we did a documentary on the work, we see a actual consciousness shift, a shift in their consciousness. When you can heal a really significant trauma,
could you tell briefly what was the context?
Well, this was 12 years after the genocide, and our team was working with the orphans from the genocide. And this elderly man came from a nearby village at lunchtime and asked if they would help him. And he had been forced to watch his wife and children cut up in front of him. And then they used a machete on the back of him and left him for dead. But he didn't die. And so he suffered the flashbacks and the memories of that for 12 years. He was despondent. He was hateful, vengeful, a very angry and despairing man.
With nightmares every night.
Flashbacks, daymares they call them. Flashbacks during the day, not just nightmares, yes. And so one of our therapists came and treated him for the trauma with that, and he immediately said, it's now a distant memory, and he went like this. It was out there somewhere, and he went home, and he came back the next day, and he said, this is the first time in 12 years I had no nightmares. He says, now can you help me, because I'm dizzy, I fall a lot, I get dizzy. And the practitioner that was working with him thought, maybe that was because of the neurological damage. They did the collarbone breathing, which is another very big difference and a very important one. And he walked away fine. And he came back the next day with 26 villagers, and he said, can you help them? But the real significance worldwide to humanity, I think, is when he came back to the orphanage that weekend, he stood up in church and he said, I have been given the gift of healing. I will take 4 orphans into my home. He shifted in his perspective in the world from anger, hate, vengeance, despair to one of love and support, community, trust. And this is the kind of shift we have seen around the world in the trauma relief work.
So in the trauma relief work, you really don't have to get into the trauma.
No.
And it's interesting that you mentioned the collarbone breathing. It's one of those tools that disappeared in other energy psychology modalities or techniques that you still use very much. And
we've expanded the use of it, actually, as the reversals. As we've learned to use these things, we have expanded their use. And the collarbone breathing is extremely useful in aligning yourself to your end goal, to reaching the positive.
Could you explain a little bit just what it is or where it comes from so people know what we're talking about?
The collarbone breathing is an exercise that Roger developed. He was working with George Goodhart, the father of applied kinesiology, and they were working with schizophrenics and bipolars. And George was using craniosacral manipulation. And Roger was looking for something that they could safely self-apply, because craniosacral manipulation needs to be applied by a very skilled practitioner. And this is where the collarbone breathing was developed in that context. And when we began using it, it was used as a neurological alignment for getting over a negative problem, a negative condition, a trauma, for healing. As we've begun using it and finding how important alignment is, it's very useful in aligning ourselves to our end goal. For instance, you want me to give an example?
Yes.
For example, in weight loss, with somebody doing all the right things for weight loss, this is the first time I discovered this. Their collarbone breathing was in alignment. We had worked on eating and exercise and all these things. And one day I had them doing what we call peak performance visualization, because you can improve their ability to visualize with TFT. So we were improving her ability to visualize herself at the ideal weight, which was 30 pounds less. And I said, how do you feel? Can you see yourself? What are you doing? And she described the whole picture. And then I tested the collarbone breathing, and it was out.
Because her vision was great,
but she wasn't aligned with it.
Breathing was wrong.
So once we did the collarbone breathing with that image in her mind, the whole process became easy. She said, it's easy now. It's so easy. I can stick to it. It became an easy process because she was aligned to it. And can I explain what the collarbone breathing is? What we find is it works kind of like the cogs in the wheel of a bicycle. When they're aligned, the bicycle has leverage and moves forward with ease. When they're out of alignment, say the bicycle hit the curb or something and it tweaked the cogs, the bicycle is still going to move forward, but it's going to be a much more difficult, lurchy, jerky movement. That's what happens in life. If we're just slightly tweaked off center on something, it's going to be a more difficult process. So the collarbone breathing is used for aligning ourselves to healing, to getting over things, but also to our end goal or to a process that we're trying to stick to, a plan.
Because one big difference also is that you use real numbers from
right.
-10 to 10. It's not just, why don't you tell us?
When TFT first started, Roger was a clinical psychologist, so his focus was getting rid of negative emotions. And over time, it evolved into physical and mental and spiritual things. But it was not just about getting rid of the negative, okay? It's about enhancing the positive. So, for instance, we have one specific block that talks about that. There's a lot of difference between being over the fear of public speaking and being a dynamic, confident speaker or calm, confident speaker, as an example. And I first found that we have a reversal or block that checks that's called I am, and that means your entire being is in line with that. You could say, I am over the fear of public speaking, and there are no blocks and you're fine, but you then would show a block to being, I am a calm and confident speaker. And that's the next step, is facilitating you to reach that goal. Right. And the levels of blocks that we have now, Roger started with 1, and then there was 2, then there's 3. We have 5 levels that can be tested and demonstrated so clearly, and we are now working with a 6th one, which is a multi-dimensional being state. But as we evolve as a species, okay, TFT has evolved with us for the needs. 20 years ago, we didn't really need to test any multidimensional anything. We were just in the physical. But as the species evolves, we need to be able to access and work in and clear other dimensions, our subtle beings, our energy bodies as such.
Right. And let me think. Yeah, they can cut that part. So to be clear, when you say we can test that, at the beginner's intermediate level, you use the muscle testing, and most of our viewers would know that.
Yes.
And in the advanced training that you will teach next year, then you have more subtle self-testing.
We're actually working more, that level was called ages ago, voice technology. The voice is an access to our vibrational energy. And we're working actually with the vibrational energy. We're tuning vibrationally. And it allows us to do like what I did in the class. In a matter of minutes, I was able to totally, without her saying anything, she was just sitting there crying. I was able to tune in, check her reversal, give her points, and if we had had, as an example, may I say,
Yeah.
had to do the EFT algorithm, we probably would have had to go through it 4 or 5 times to reach a calmer state, whereas I came up with 3 points, and they weren't normal points. I know one was lung and one was liver, and it was just what she needed, and it allowed us to access that energy very quickly and very specifically.
So it makes TFT a true, pure energy technique, right?
Correct, yes. Mm-hmm.
And those more advanced testing tools, they allow you to work remotely.
Yes.
With animals.
Yes.
And interestingly, with animals, there are no
Placebo.
effect. Can you tell us a little bit more about that, so people know also what are more the advanced tools they can use later once they're trained?
It allows you to, I know in all levels of TFT and EFT, a lot of people tap with animals, and that's fine. However, if you need to determine specifically or test or identify what you need to do, then being able to do that vibrationally is a much more specific tool.
That's right. I have a dog I have adopted that was mistreated, but I don't know what the trauma is. But with your technique, I can find out what needs correction, right?
Exactly. With animals and infants, okay, they can't tune to a thought field, okay? You can't tell them, think about this, so you have to have them in the perceptual field. So
when she gets scared, when she gets anxious.
Yes, it's like I said yesterday, when somebody is feeling an emotion, that's a perfect portal or access point into what needs to be treated. It's the perfect time to do it. I think in Greg Braden's work he talks about the emotions of the language of the matrix. Okay, when they're feeling it, excuse me, it's the perfect time to diagnose or determine exactly what they need right then. And then you can do it, and you can do it very quickly and very simply.
Right.
So same with the animals, same with an infant. Okay.
And that brings us to anxiety, because one thing you have is what we would know in France as energy routine, but you call it constitutional sequence. And you can tailor it to a person to use every day, right?
Right. What I do with our clients, and I teach all of our trainees to be able to do, is most people's lives are complex. And by the time they don't come to me first. By the time they come to me, they have had 40 years of all kinds of things, and their whole life is a mess. And so I try to give them the tools that they can use to help themselves on a daily basis. So a constitutional sequence will test and determine the exact points they need in the order, and they use it daily in the morning, thinking about what they have to do that day. What's causing them anxiety because they have to drive to school, because they have to meet the mother-in-law for lunch, because they have to this. All the things that are causing or triggering that anxiety for the day will be what they're tuning into with their constitutional sequence. Then that night, they use that same constitutional sequence for what actually happened to that day. Not what they think, but what happened before they go to sleep. And what we're doing is treating and healing the anxiety on a daily basis from the before and the after, and the daily traumas. Especially for anxiety people, life is a trauma. It's a trauma if you get stopped by the police on the way to work. For those people, everything is a trauma. And if you can treat those on a regular basis very specifically, it keeps them constitutionally stronger, and they can begin healing. Right. So we also create a specific 5 PRs sequence for them. And when we do that,
maybe just PRs are psychological reversals
or blocks, and maybe theirs would be, for this person, it would be releasing all the blocks to remaining calm and centered no matter what's going on around them. Or we have mothers that just are ready to tear their hair out by the time the kids go to bed at night. So maybe it's remaining a loving, peaceful mother, no matter what the kids are doing around me. And we release the blocks in all the levels, all the past, all the present, all the future. And it's a simple round of 5 tapping points that they can do, focusing on releasing all the blocks to what it is they wish to be. Not getting over the anxiety, but being what they want to be. Combining that with their constitutional sequence, which has been tailor-made to them, strengthens them and puts them toward their end goal every day. Yeah, wait.
Because with the psychological reversals, not only do you work in the different time dimensions, past, present, future, in the different dimensions of the being, but you test at the general level, intermediate level, specific level, dozens of possible psychological reversals.
Let me, may I give another example? These are just examples that happened in the last 2 days. We just had an advanced class, and this woman is an excellent TFT practitioner, has been one for a long time, trained at the top level. And we have now a new advanced level. And they were practicing identifying these levels of blocks to what they're trying to accomplish. And I tell them, first get a broad one, because then you're not limiting yourself. Then you get an intermediate one, and then very specific was anger toward the husband. Okay, that would have been the specific one, testing for blocks. When they finished their practice, I said, did you check for accepting your husband? And she said, oh yes, and there was no blocks. I said, all right, now test this way. I want to accept my husband as he is. Immediately she goes, ooh, and she tested that was where her block was. Had we not been able to specifically test that, we wouldn't have been able to reach the same access and results within her relationship. We would have been guessing. Guessing and accepting. Everybody says those things. Everybody thinks, oh yeah, I want to accept him. But the specificity of the words make all the difference in finding the actual block and not finding or passing right over it.
And one thing that I find really interesting also in TFT is the protocol you have for forgiveness. As a forgiveness circle practitioner, Olivier Claire is the person in France who developed this technique, and you have also a protocol for forgiveness. I mean, of course, forgiveness cannot be forced, but you have something to allow it.
We do. First of all, forgiveness is absolutely utmost important in healing, and not only for the person. I had a client not too long ago that got hit by an SUV in a parking lot, and when we treated the trauma, then right away the anger came up. So we had to work on the forgiveness for forgiving the driver, but then also for forgiving herself. Everything, almost always, when you're forgiving, when forgiveness comes in, you need it for yourself too. And so it's a combination of treating it so that you can allow it, but also to release the blocks from resisting it, from not being able to forgive. Right. If you're blocked, you struggle.
Right.
It's much easier if you can release the blocks. And again, that's being able to identify exactly what those blocks are.
Right. So maybe just a word on who can train, who can join. Most of our viewers will be EFT, well, nice Freudian slip, will be TFT, but most of them are already EFT practitioners. Can you just say who should take this training, who should attend?
Well, I'm not sure what you have as far as IFPEC, as far as their guidelines. For us, okay, we allow anybody to train because my goal is to have it in the hands of everybody. Right. And it's been done for almost 40 years now without any harm. So we believe everybody can learn from it. There are some practitioners that feel that only practitioners should have it. However, had we done this, there would be 25,000 people in Rwanda that wouldn't be healed because we have a lot of community leaders using this. Anybody that's had the beginning levels of TFT, of EFT, or just in general, you can learn how to be so much more specific and get so much further results than what you're already getting by learning the process of identifying exactly what you need to do, rather than using a common tapping pattern.
Right.
So for me, anybody.
Yes.
But
so I want to thank you. Thank you for everything that you're doing in the world and sharing this wonderful tool, which makes a huge difference. I have to share that you intervene in training with me, and within seconds, everything was gone, and it was just mind-blowing to me how much faster you were able to get to the core without even me talking about it. And I was calm within seconds. So thank you.
You're welcome.
And I really do hope that many of us join us for the training. I'm going to be doing one in May, one in July, so that you can then come and meet Joanne when she comes next May. We don't have the dates here.
Next.
Oh, not this one, the one in a year.
Yes. Next year.
Yeah.
Next year.
Yes,
I'm looking forward to coming back to Paris.
Yes. So you get more of the advanced tools with the different self-testing tools and the remote testing tools.
Can I just make one single comment? For me, that level is the most self-empowering thing you can do for yourself. That level. The tools that you'll learn empower you to really radically change your life.
When you say that level, you mean?
Meaning the optimal health level.
Yes.
So now, in order to take the optimal health level, you need to take the intermediate diagnostic level, because that's your basic. That's the basic structure. All TFT started with that level. Everything started there, and so that's the basics. But when you advance through that and into the optimal health level, it really is the most self-empowering level, I think, that you can do.
And an example of how to use this on a daily basis for yourself is you go have lunch, you're feeling a little bit tired, you can test for your toxins, what you ingested, and neutralize it. I mean, of course, if it's a toxin for you, you want to eliminate it, but you can neutralize it and be awake for your meeting or whatever you're doing. Or in the last training, we had someone who had a headache, right, or a neck pain, I don't remember.
Oh, yes.
Neck pain. It turns out she was wearing...
She bought a new scarf.
A new scarf she just bought. And it was toxic for her.
It had Scotch Guard and all the chemicals in it. She hadn't washed it yet. She put it around her neck and had the pain in the neck. What happens? It was an old injury, so it's a weaker system. We had somebody else that had that, and so what happens is when you get overloaded, like travel and stress, trying to learn something and do all these things, when you're overloaded, that weaker system will break down, and so the toxin was a little too much. The old injury then flared up.
Right. Anything else you want to say?
No. Welcome to all of you. I'm very, very gratified for me to see the EFT people coming back to TFT and seeing there are differences and that there is more past the beginning levels that we originally had.
Yes. Thank you very much.
Thank you.